Threads. Well, I don't want to spend too much time on them because you already are a powerhouse there. But I do want to talk a little bit about, we have a lot of people that watch this besides aesthetic providers.
Nice.
And what do they need to ask? Like, what are questions that you walk in to your provider and say you have a chin that's down, or, lower face that's down. Submental. You need more of a facelift. How do you approach, what are questions people should ask someone before they get threads is what I'm saying. What are some key questions?
Yeah, I think that's a really important question because you sort of fall into two categories. Those are the ones that probably may need surgery, and three categories rather. The ones that need surgeries, the one that not quite ready for surgery, or the one that can't have surgery. So you have to decide. Or
can't afford.
Correct. Yeah, and that's true too. So I get a lot of those kind of questions, but I think really, of course, you have to trust and you have to feel comfortable with your provider. How many of treatments have they done? Mm-hmm. I'm not so concerned about, yes, you need to learn how to execute. Yes, you need to be an expert in what you do, but are you able to fix if something goes wrong? That's really what you're really wanting to understand, right? Because even the best plastic surgeon, they need to fix what's wrong, not just what's right. Of course, you need to execute. Of course, you need to be excellent. All of that, of course. But I think that's a complete. That's what I was talking about when I was in Miami this past weekend, because that was my assignment. It was the psychology of assessment. And when a patient comes in, they really need to feel comfortable and they need to be honest. And the provider also needs to be honest. It's so much psychology in there. And you have to be able, as a provider, to read who is sitting in your chair, why they are here. They have to trust you, because if there's not that trust, it's very difficult to recommend. And it's difficult in any kind of relationship, right? So they need to feel comfortable. That's the first thing. And then they just need to be really honest of where they are. Hey, look, I really would like a more permanent solution. I want it to last 5 to 7 years. Then you're a surgical candidate. Or if a patient says, I really would like to improve this. I'm not looking for perfection. What can you do? Then that's a different kind of conversation. It might be a combination. Maybe it's a little bit of neurotoxin, then some threads, maybe a little dermal filler, maybe it's some laser. It depends. There's so many different, I love that. Exactly. There's so many different things that you can do to kind of go down that rabbit hole, but it's a journey together and you're doing it together.
Yeah. I like that.